Okay, this is going to be over the craniosynostosis, however the heck you say it. So, what this is premature closing or fusion of the cranial sutures. So your skull has sutures, the little lines of plates that connect. So this is whenever it closes too soon. So risk factors of this, idiopathic, it's unknown. For the most part, it's unknown. Or it can be due to some genetic syndromes. The examples that she gave were Carpenter syndrome, and then Apert syndrome was in the book. So these two syndromes can also cause this, but for the most part, it is unknown. So signs and symptoms of it is going to be an abnormal head shape because it's closing too early, so it's not closing correctly. And then increased intracranial pressure. Signs of this is going to be them being irritable, vomiting, seizures, and vision problems. And whenever you're assessing it, you're going to be able to feel the prominent bony ridge that can be felt. So they're on the suture, you'll feel it. It'll be bony and you'll feel the ridge. So treatment and nursing management. You can do surgical correction. So if it's only one suture that closed too soon, then you can do surgery, but it'll be for cosmetic reasons. So your head shape can look more normal. Sorry. But if it's more than two or more of the sutures that closed, then when you do surgery, it's going to be to prevent neurological complications. So if it's only one suture that closed, you're okay, but you want your head to look normal. So you're going to want to monitor for complications, and this specific is in post-op care. So you want to observe the hemoglobin and hematocrit levels due to the large amount of blood loss. You want to observe for pain, hemorrhage, fever, infection, and swelling. There's going to be large amounts of facial swelling during the surgery after, and this is expected. And this is because of the facial swelling, it can cause the inability for the child to open their eyes. They won't be able to open their eyes. So make sure the parents are aware that after the surgery, they're not going to be able to open their eyes because their face is going to be swelled, and it's expected. It's fine. You also want to encourage the parents to talk to and hold their child after surgery, just like that they can build that trust and that comfort level back up. Now, we're also so that was craniosynostosis, and now we're going to look at plagiocephaly. So plagiocephaly is the flattening of one side of the skull due to positioning, or flathead. We know this as whenever they're on their supine side, their supine position for too long, their back of the head will get flat. So they don't have enough tummy time, right? So risk factors, supine position, limited tummy time. Another one that she really wanted us to focus on was called torticollis, which is tight neck muscles, and the muscle is shorter on one side. So signs and symptoms is going to be the asymmetrical head shape. You're going to be able to look at the infant's head from the top, and you'll see that they have a flat head. Now for the torticollis, you want to assess the range of motion on the neck so you can see that. And then you'll want to palpate the cranial sutures. Make sure if they're not overlapped. If they're not overlapped, plagiocephaly. Treatment and nursing management. Repositioning. Sorry. You want them to have more tummy time. So just put them on their stomach, carry them more often. You don't want them to be on their back of their head for too long. Helmet therapy. That's always an option too. You want to do physical therapy for torticollis. And for torticollis, you want to place a rolled washcloth on the affected side to prevent them from turning that way. So they're always going to want to turn towards the affected side or the shorter side, and their head will start to literally turn that way. But for them to not do that, you're going to roll up a little cloth and you're going to put it on that part of the neck so it holds it and they're steady. That's going to be those.